I usually tell my medical students and my residents or the fellows that come through is that patients who are addicted are basically could be our best friend, our neighbors, our kids. And again, as we learn about the epidemic and and just addiction itself, I think we really had to realize that treatment is so important because we all are in this together. And I think our foundation had made such stride with changing the environment of where we take care of our patients. Now we brought them into a beautiful facility where I think everybody deserves to be in a beautiful facility where they will be treated like everyone else, sort of with the highest standard of medical care. Again, they have the option of using our psychiatrists to take care of some of their psychiatric needs. We have counselors there to help them dealing with their issues. We have open access groups that they can come in for treatment. And we also have, as I say, I'm so proud of my medical clinic that we have the best doctors, and we have a consultant from Yale that works with us. We have addiction fellow that we can provide them with the best medical care and referral that they need. So I think this kind of sets up apart, and the fact that we can take care of most all their needs in this one facility is exceptional. I think the App Foundation is one of the only places that does give patients the same day treatment evaluation. I think everybody is catching up to this, but then the idea, even in 1990s, patients generally have to wait 6 weeks to get in methadone program, and you wonder why then. And the idea would be, well, they may not be ready. We want to make sure they would show up. At that point in time, that was sort of the standard of care. And over time, we've been able to push the envelope and to say, well, we really want to have patients come in, they sign up, they see somebody, they maybe within 48 hours, they're going to see to be admitted. And the wonderful thing with that foundation, because as I say with Stability Health Central Medical Unit, is that we actually then end up being the provider to do the medical clearance for any patient coming on methadone. So because of the success of the medical clinic, we can say patients walk into Access Center right now, they get to see one of the clinicians. The clinician identify what their health issues is, or what the addiction problem is. They're able to connect with the psychiatrist. They can send them upstairs from downstairs to see one of the clinicians, myself, or one of the nurse practitioner, also addiction trained, to help them decide what would be the best option for them. And then the same day, we can give them an idea of what our recommendation is. If it is a medication-assisted treatment, we can provide them with Suboxone. If that's the appropriate, we can provide methadone. We can make recommendations if they need inpatient treatment. We can make recommendations if they need to be hospitalized. We read about the opiate crisis. We always think about the young people that overdoses on opiates and such, and how we try to rush to save them. I mean, we have patients and clients, we call it, who are in their 50s, in their 60s, in their 70s, living with their family, taking care of their grandkids, where we provide them with their medical care. My medical students sometimes ask how I take care of patients with opiate use. I said how I solve the problem with opiate use disorder. I solve them one person at a time. My job is to convince one person in front of me to say, don't use today. One person at a time. That's my job.